this is Pretender Core student of BSN 266, and I will be showing how to administer IV medication and IV fluids to a patient. And I am entering the patient's room right now, and I have introduced myself as a nurse, and I have provided a adequate privacy to my patient, and I have performed hand hygiene. And I have asked my patient about their full name and date of birth to identify my patient that it is a correct patient. And we will be administering a IV fluid of 150 ml with a drop factor. We will be figuring out the drop factor, and this is my math, and I have figured out the drop factor. It would be 38 drops per minute with this IV set right here, which the drop factor is 15 drops per minute, so it comes out to 38 drops per minute. I will be asking my patient if my patient has any allergies to any type of medication, any fluids or anything, and patient has no allergies. And I will be performing hand hygiene again. And donning on my gloves. And the patient will be receiving normal saline of 150 ml at 38 drops per minute, which is right here. And this is the IV line. This is the spike end, and which goes into the IV bag. And this is the drip chamber, which gets filled with fluid halfway here. And this is how we calculate how many drops and if the IV is actually doing okay with the drops and everything. And we will be priming this line right here, and this is the clamp right here, our roller clamp, which we can use to clamp our IV and set up the drops, how many drops we need. This is the white port right here, and this is the adapter that which connects to our patient. So I will be priming my IV right now. Oh, and this one right here is where the medication goes, and this is for fluids. Spike. Prime right here. There we go. And then we're gonna clamp this right here. This one right here, and we will be, and I will be counting the drops right here for a full minute. we have the IV line going right now at 38 drops per minute, and the doctor has an order for amoxicillin given for our patient, and I will be doing the 6 rights of my patient's name, date of birth, and it's a correct medication, correct dosage, will be given at correct route, will be given at correct frequency and correct time. The amoxicillin is ordered at 250 milligram IV in 100 ml NS over 15 minutes, which the drop factor will be calculated. The drop factor is 15 ml, and the drop factor is calculated 100 over 60 times 15, which will be 25 drops per minute, and the patient will be receiving 25 drops per minute with the secondary line. Again, the patient has no allergies to any medication, and it is our correct patient. The patient's name and date of birth matches with the patient's band. And this is our secondary IV tubing right here, and this will be used as medication, which is the right medication. And I will be priming this. Again, the spike, drip chamber, roller clamp, and then the adapter. Okay, fill this up halfway, and we are going to clamp. Clamp this medication. We're going to take an alcohol swab right here and clean off our black port right here, and we are going to clamp it like this, so. And we are going to cover our adapter right here. And this IV, right, the medication, because it's a secondary, this will go above, and this IV fluid is 30 inches above the patient's IV pool. Oh, sorry, it's hanging above 30 inches above the patient. This will be hanging low. This will be going at the primary site. This will be hanging above the primary. And we will be connecting this, and we have already cleaned it site with an alcohol swab. connecting this right here. And we will be putting the drop factor of 25 over here and counting the drop for 1 minute. Right here, okay. We'll be slowly unclamping. Okay, so the drop factor of 25 has been set on that IV, and I will be checking my patient's IV site for any infiltration, any phlebitis, any pain, swelling, redness. My patient has no complaints of discomfort at this point. Patient has no allergic reaction to the medication, and patient has stated that patient has no any allergies to any type of medications. Once this medication is done and the fluids are done, I will be checking back on my patient and reevaluating. For right now, the medication is running, and I will make sure that the patient has the call light within their reach, and the patient is comfortable, and that patient has no concerns at this point. Thank you. Oh, and I'll be donning off the gloves and discarding them. And hand hygiene. And patient is resting with no complaints and with the call light within reach.